I'm going to present you. Our presentation is about SARS-CoV-19 testing laboratories, the status of the laboratories when they were audited, specifically looking at a few selected COVID-19 testing laboratories, majorly performing PCR. And we felt it would be due to actually follow up with the current status of biosafety, biosecurity in the country, which our advisor Paul has just presented to us elegantly. The authors here are Joseph Kodio, who is the National Coordinator, Biosafety, Biosecurity, one of our own, Benson Simsu, who is a National Trainer, then myself, then Paul Kalinga, the National Advisor on Biosafety, Biosecurity issues, Mr. Ted Kajilita, and our own ED, Dr. Susan Nawada, who is in charge of biosafety across the entire laboratory network. Let's go to the next slide. Basically, we are still talking about biosafety, biosecurity, looking at those principles that we put in place, the principles, the technologies that we put in place to prevent any risks that could be due to unintentional exposure in our laboratory setups, in our research setups, and biosecurity, which could be either theft, risk theft, misuse, or resulting from intention. So we believe that those two really need to be strengthened as we strengthen our entire health management system as a country, and that's why we took time to look at them in detail in these laboratories that were testing COVID-19 at such a particular time when as a country we are at a very big risk. And due to even our own, we really have our own health professionals who lost their lives due to this current pandemic, and we really took in interest to look at those sites in COVID-19 testing. The sites which were selected were accredited by Ministry of Health to conduct COVID-19 testing, PCR, and this audit was basically aiming at evaluating and assessing the current situation of those laboratories that were testing COVID, or which are actually still testing it. Those laboratories that were accredited for PCR by 2022 were around 26 or slightly more, but out of the 22, we selected 11 of them, and in the 11 of them, the criteria that we used, first of all, the auditors that carried out this specific audit are nationally certified by the Ministry of Health and internationally certified by International Federation of Biosafety Association. And coming to the categorization here, which Paul has already talked about, still in the methodology, while you're using the National Biorisk Management Checklist, auditing those laboratories, we're categorizing them, their performance, the average score was categorized in the same approved categorization in the national checklist, looking at very high risk as being below 30%, high risk between 31 and 49, moderate risk between 50 and 59. If a laboratory scores between 60 and 79, that's categorized as low risk. Then very low risk, a laboratory above 80. In the results from those 11 facilities, out of the 26, accredited to conduct PCR, although by now there could even be more facilities accredited, more than that. And basically all laboratories with capacity were given authority also to conduct rapid COVID-19 testing. So when we looked at these 11, looking at their number, if the ones here are not visible, looking at Rwanda Health Sciences Project, Medical International Hospital Laboratory, IOM Laboratory, the Uganda Cancer Institute, the Fred Hudson Laboratory, then Case Hospital, Lancet, Test and Fly, MBN, then look at the border points, mobile laboratories, the Tukula one, the one in West Nile, Ajuman, and the Torah Laboratory. So basically this we looked at the facilities with high volume to get a clear picture of the state of safety and security in those laboratories. But when we look at here the scores, basically all the non-mobile laboratories scored in low risk and very, very low risk due to the capacity they have at the moment. Then the mobile laboratories in the border points got moderate risk. And here we're looking at basically the technical requirements, looking at all the areas that Paul has just prior talked about, ranging from let it be personnel, all the practices, looking at fire safety, all the way out to continual improvement, but excluding the managerial aspect. So we only looked at the technical requirements of the checklist. With this, the outcome was that the moderate ones, the ones that fell under the category of moderate performance, a section of 9.2%, which was the other category of the mobile labs, which were only 3 and they were lower. Then the low risk and the very low risk, which is the other category of laboratories that we have talked about. So there is some information missing here, one slide missing here, but basically it's about the discussion of the results, and you don't need maybe through the capturing information here or very different PowerPoint. But basically our results here in the discussion of the results, we are talking about the average of those 11 laboratories being at 78%, which is falling under the moderate risk. But to us as a country, we believe this is, according to Paul's presentation, is not the category of all the laboratories in Uganda. This is basically the laboratories which were from around 70% of them high-level private setup laboratories, and which have been given enough capacity to strengthen their structure, their infrastructure, their equipmentation, and when you look at all the 12 quality elements, they have been given really intervention to strengthen their quality management systems. That's why you see the overall percentage here being 78, but look at the overall national safety and security being in the high risk category, being around 40. So as a country, though the accredited PCR testing laboratories fall under moderate risk, but still the picture of BRM in the country, biosafety, biosecurity, we still fall under high-level risk category, which we need to give attentive attention as a country and look at how to really improve our status as a country. That's why our recommendations are focusing that we need to do much more enhancement of collaborating and engaging all stakeholders. I'm glad somebody asked about the private sector. It's a big cohort in the presentation. Look at all the MDAs, all institutions implementing safety and security. We really need to work together and see how we strengthen biosafety, biosecurity across our country to promote a safe and secure environment. Then there is a need for sustainability by implementing continuous quality improvements through our daily implementation. And we are also recommending that one of the hindbacks that are letting low performance, one of them is infrastructure across all the laboratory tiers. We recommend through our implementing partners, through stakeholders, through managers at all levels, there is a need to strengthen and improve and renovate and strengthen our infrastructure. In conclusion, basically, our laboratories that were audited, the COVID-19 testing laboratories, were compliant to biosafety, biosecurity, and despite that, they were accredited to perform the test, meaning they had the underlying capacity to do that. But though the underlying capacity, we would not take it for granted, we really need to confirm and see if they are compliant to safety and security requirements. Then we are saying that management, commitment, technical expertise, and the functional safety committees are very key and crucial in strengthening biosafety, biosecurity. So in our institutions, through collaboration, through engagements, so committees are very key and crucial and give accountability for enhancing sustainability. So with this, my great thanks and regards to our partners, Ministry of Health, the National Health Laboratory, Moni University Group, then JCRC, UVRI, and MAC. So thank you so much for listening and stay blessed.
Thank you very much, presenters, and all. Actually, I was very, very attentive during both presentations because I really have interest in biosafety and biosecurity. From both the presenters, I really got worried. One, from Diana's presentation, I realized that really most of the labs assessed here were private, and the findings, ideally, and the conclusion Diana made was it seems most of the labs in Uganda are high-risk laboratories. From the PSSC opening remarks, she talked of us building resilient, efficient, and sustainable systems, and looking at the outbreaks we are getting, and the state of our labs. What are we going to do, or what have we picked from this presentation that we are going to do to sustain the efforts? It's as if we are going to go back to 2015, because there was some contradiction. Paul presented good progress concerning, I think, where we were scoring 1 and where we scored 3. But Diana said last year we were high risk. Are we going to sustain that? Thank you.
Thank you, Diana, and the Paul, my brother from another mother. I was very passionate and listened keenly. My name is Paul from Kampala. I wanted to know, I've checked on the scores that Uganda we are doing bad. So my question is, what is Uganda as a country doing so that we can improve on our scores in DRM? And then I see that the facilities that you assessed, there were, if not mistaken, either 52 or 44. How did you select those facilities? And on a lighter note, as my neighbor said, I've seen most people shaking their heads in the amusement. So how does one join, or if they're interested in the biosafety and biosecurity, how do they join you and handle the manpower? Thank you.
Thank you, Paul. Any other questions?
Thanks, Jerome. My name is Patrick Sakibu. I work with the Uganda Blood Transfusions. But I'm here in the capacity of the Secretary of the Uganda Medical Technology Association. Good morning, ladies and gentlemen, colleagues in the fraternity. Good afternoon. I want to take this opportunity to thank my brother Paul Walinga and Diana for the presentation. I realize biosecurity is a key component of quality laboratory services in the country. I have a few concerns. One will be going to Paul, the other one going to Diana. Way back, I think before 2016, there was a comprehensive approach of trainings all over the country. And I think the trainings will expire after a period of time. Probably the certification you get will last for not more than 3 years. I would want to raise a question to Paul. What approach is being undertaken to ensure that this is revived to comprehensively see that professionals get this training? To make reference to Kenya, for example, Kenya has undertaken biorisk management as a major component. And as we speak, they have training programs. We have lab professionals training as biorisk officers, and it's really a key component, as you see. And the reason they undertook this was simply because it was a major gap among the lab professionals, and they want to assert that the House agrees with me, colleagues who have undergone training in the lab sector, that biorisk and biosafety is a component that is not seriously undertaken in the training. So I want to raise a question to my brother Paul, now that we have a very vibrant office and headed by you, if there is an approach that you're undertaking to ensure that professionals are able empowered in this. And of course, I want to thank you that you stated that you will undertake a comprehensive approach, or you assessed both private sector and government sector. I want to raise another concern in there, that how are you going to employ the private sector deeply in this activity, not forgetting the small-scale laboratories that we know contribute greatly to the healthcare service delivery. Last for you, Paul, is yes, we have got, I think, if anything, over 20 accredited labs in Uganda and the government. And in your assessment, what were the key gaps that you found if these labs were part of the assessment, and yet we have them accredited in this aspect, of course, biorisk management inclusive. The other one goes to Diana. Diana, in your presentation, you talked of certainly the labs that were included in the findings that you undertook. And you said you selected 11 facilities. Like one of the colleagues stated, we saw that a number of the labs that you put across were private labs. What was the challenge that made you not consider government labs, majorly those that were accredited? And yet we know, in a way, besides just the testings that are done, the PCR-based, we have what these labs are collecting samples in line with COVID-19. And lastly, you talked of one of the key challenges you found was the structures in these laboratories. What exactly do you refer to the structures in those laboratories being a major challenge for this? Otherwise, I want to thank the organizer, Leonard, the CEO of this arrangement. It's a very, very prudent session, and I want to encourage that subsequently we build this forth to strengthen the quality of laboratory service delivered in the country. And as I wind up, just to remind us that there will be a conference for the latter in November, 3rd to 5th in Mukono Colin Hotel. And I want to encourage my brother Paul to bring up this paper and present to the professionals during the conference. This is a key component that we've seen year in, year out, not considered seriously. Thank you very much, ladies and gentlemen, for now.
I think there was a question over there. I don't know if it still stands.
My name is Martha Akia. I'm the AAR as a laboratory technologist. So my concern to you, my question is for Paul. Paul, the presentation has been very welcome. Unfortunately, I'm very worried with the conclusions we deciphered. Because if we are having biosafety and biosecurity going below the year you started, then this is very worrying. Especially concerned about OSH, occupational safety, and health. Clearly, you say almost all the labs are in the high risk zone, almost generally. So I'm concerned. You said there was no OSH program at 33%. Enforced. Partially established was 11%, and established programs at 56%. Paul, this is putting us at roughly just above average in occupational safety and health. As a lab team who is dealing with Ebola right now, we've had COVID. I'm assuming at JCRC, you said it partially worked, I remember correctly. I am assuming that this is something that is very important, and I want to inquire, is this together with the government? Because the last time I had a training on OSH, it was a specific entity that came to train me on occupational safety. And as a lab personnel, I got training, and I have measures that have been put in place at my workplace. So you concluded that 56% established a program. What I want to find out from you is the 56% that you initiated, what have you put in place to get compliance? Because it could be paperwork as well. So it would be on OSH where we are aware of what OSH is and what the paperwork is, but literally down, that is reflected in the report of this number. We have OSH and say initiated 56, we have most of the labs at high risk. So Paul, what is the way forward? Especially for both the private, I'm happy this time seeing private and government included. So this is a general marker. As Paul, as head of biosecurity, management and safety, who does this report? How do you get it done? I want to know what is the way forward and what is the recommendation, and is it something we can take? Thank you.
Thank you very much. I think we'll have one last question.
Yeah, I first thank HuQAS has handled closer to more than 70% of the questions that were targeted to us. Most of the questions were about what we plan to do, about the strategy that we have as a country to improve biosafety, biosecurity, and he has ably answered them. I will again echo to the question that Paul asked. How does one join biosafety, biosecurity? Biosafety being a component of quality management system, I believe there is no specific way or a specific integral way for joining. Basically, it has talked about international regulation for biosafety, that's at an international level, equipping yourself with knowledge at an international level, but then basically also at a national level. I believe implementing biosafety, biosecurity first, empowering biosafety, biosecurity first in your region is the first earmarking way of really strengthening the system, because the cohorts, the teams of trainers, the auditors are all coming from facilities across the country. I remember sometime back in 2018, there was a national call for people who are going to be enrolled as auditors who pass through some basic interview and assessment, and also being trained in basic biosafety, biosecurity. But the major first way, I believe, is through implementing biosafety, biosecurity. I don't know at which level they were specifying, but if at all it's at institutional level and the institution is not implementing biosafety, biosecurity, you need to get in touch with the National Coordination Office for Biosafety, Biosecurity that is housed at the National Health Laboratory Services in Atwijuka, and will be part of building capacity for that institution, will be part of capacity building to train the frontline health workers or even the managers. As you saw, we have 3 tracks from post-implementation. So I believe joining biosafety, biosecurity is really easy to join, or depending on the level the person was asking, we can really talk about it if there is need for more clarification later in the breaks. Patrick asked about why we considered a bigger percentage of private sector laboratory in the assessment of COVID accredited testing laboratories during the biosafety, biosecurity audit. On the selection criteria, the major priority by the African CDC, which was supporting the audit, was high volume facilities. And the government high volume facilities, which were Mulago, UVRI and the Central Public Health Laboratories, were actually part of the capacity building laboratories which spearheaded the strengthening capacity in the area of training, training frontline health workers when the pandemic came on board. So the fact that they were part of capacity building and strengthening the system for the pandemic, those 3 were not much of priority. We were really confident of the biosafety, biosecurity state they were in, those 3 national reference laboratories, and also to having limited implementation of biosafety, biosecurity in our private setup. We really felt we needed to assess what's really happening in our private setup, especially the high volume ones, and especially the highly established ones, which were at the front line for testing for COVID-19 PCR. That's why the selection actually for the private setup was almost around here, Kampala, looking at Case Clinic, Lancet, NBN. Then basically it was not only, it may not be sold only private, because the private ones here are 5, then the rest of the 6, we are looking at IOM, which is basically looking at having much emphasis on migrants, which I may relate it. It's a private not-for-profit looking at we call it much more of a community hospital. Rakai Health Sciences Project is also a community setup. Then the mobile laboratories, the fact that they were mobile, they were created or were strengthened during the time of COVID, a pandemic, when we really got into the heat up of the situation. The structures for those labs were just strengthened in a short time, and they were key eye catchment to be audited and see the high volumes they were having at that time. Are they really having the capacity to ensure safety and security of the entire population across borders due to the inter-movements of the people across those borders? Also, I would like to clear out still on the audit average score. The private ones that were assessed specifically for COVID PCR, they actually create a picture that all is well in Biosafety, Biosecurity, or in the private sector, because it's at 78% from the presentation. But due to consideration of, for example, the mobile laboratories, which were created specifically for testing in this short time, and were not having actually any structures on the managerial part, we tailored the audit. The scope was only based on technical requirements, which is ISO 15190. We're basically looking at technical requirements across, when you look at the 12 elements in QMS. So this audit was only looking at the technical part of it. That's why it may create a false picture that it is well in Biosafety, Biosecurity nationwide. But despite, you well know the state of our private laboratories, a high-level private laboratories, when you compare it with average facilities, or when you go to an average private facility level, when you go there, you'll be mesmerized. When you look at the structure of the laboratories in the average private clinics, you find a laboratories just in either a 20 by 30 inch room, something like that. So this should not create a false picture, and we think Biosafety, Biosecurity is well in the private setup. This was audited in the priority areas that were handling high-level COVID-19 PCR testing, and this is actually the opposite of the 29 average score, which is the state of the general laboratories in Biosafety, Biosecurity across the countries, because that is a 29 average. Looking at both human laboratories and animal laboratories, being at 29 as a country, that's actually a very high risk category. So with the strategies that Paul has talked about, with strategies that we are going to discuss as a team here to improve our health management systems, really our biosafety and our biosecurity interventions really need to be strengthened at all levels and through different engagements. Patrick asked us about what I referred to as structures when I talked about our structures not being really needing to be strengthened in Biosafety, Biosecurity. Basically, Patrick, that was infrastructure, and part of the infrastructure, which is also physical infrastructure, looking at the picture of 29%, much of the contributing factor that is also hindering into achieving achieving very low risk category, rather low risk category or moderate. One of the factors is the state of our laboratories, where infrastructure, I'm talking about the generally out of the laboratory, the containment principles in the laboratory, of which the containment principles, one part of the containment criterias or principles is affected by the structures. So leaving alone the national reference laboratories, the district laboratories, or the hub laboratories that were renovated, and the high-level private facility laboratories, you agree with me that our laboratories that tie us at health center for level, or even going downwards, they really need renovation, and the infrastructure is not well, and it's one of the contributing factors that affects the containment principles. Thank you so much.